Pathophysiology of hemolysis in G6PD deficiency. Which of the following best explains why G6PD deficiency causes hemolytic anemia? A. ATP impaired NAK pump function in RBCs. B. Osmotic fragility due to spherocyte formation. C. NADPH reduced glutathione oxidative damage. D. Heme synthesis, ineffective erythropoiesis. E. Iron overload, hemolysis from hemosiderin deposition. Correct answer C. NADPH reduced glutathione oxidative damage. Explanation: G6PD catalyzes the first step of the pentose phosphate pathway, producing NADPH. NADPH keeps glutathione in its reduced form, GS8. GSH detoxifies H2O2 and free radicals. NADPH, GSH, oxidative damage, RBC membrane injury hemolysis. A. Seen in pyruvate kinase deficiency, not G6PD. Osmotic fragility is characteristic of hereditary spherocytosis. Describes sideroblastic anemia. Iron overload is a complication, not the cause of acute hemolysis. Question 2. Triggers of hemolytic crisis. A 24-year-old male develops fatigue and dark urine after taking nitrofurantoin for a urinary tract infection. Which of the following best explains his presentation? A. Hemolytic anemia due to increased erythropoiesis. B. Antibody-mediated destruction of red blood cells. C. Oxidative stress in red blood cells due to NADPH. Microangiopathic hemolytic anemia from drug toxicity. E. Impaired heme synthesis due to folate deficiency. Correct answer, C. Oxidative stress in red blood cells due to explanation. Drugs like nitrofurantoin, sulfonamides, primaquine, and favabeans act as oxidizing agents. In patients with G6PD deficiency, these cause oxidative stress. Without sufficient NADPH, RBCs cannot neutralize ROS, leads to acute hemolysis. Erythropoiesis does not cause hemolysis. B. Describes autoimmune hemolytic anemia, e.g. positive Coombs. D. MACA causes schistocytes, not bite cells. E. Not relevant in this setting. Question 3. Epidemiology and genetics. Which of the following statements is true about G6PD deficiency? A. It is inherited in an autosomal dominant pattern. B. It primarily affects populations in Northern Europe. C. It is the most common enzyme deficiency worldwide. D. It increases protection against staphylococcus infections. E. It causes ineffective erythropoiesis with macrocytosis. Correct answer, C. It is the most common enzyme deficiency worldwide. Explanation: G6PD deficiency is an X-linked recessive disorder, most common human enzyme deficiency worldwide, highly prevalent in populations with malaria endemicity, e.g. Africa, Middle East, Southeast Asia. Confers partial protection against Plasmodium falciparum. A. Inherited as X-linked recessive, not autosomal. B. Prevalent in tropical regions, not Northern Europe. D. Provides protection against malaria, not bacterial infections. Macrocytosis is seen in megaloblastic anemia, not G6PD deficiency. Question 4. Peripheral smear findings. A blood smear from a patient with acute hemolysis shows RBCs with small dark inclusions and some with a bitten-off appearance. What are these findings called, and what do they represent? A. Target cells and Howell-Jolly bodies, hyposplenism. B. Schistocytes and helmet cells, microangiopathic anemia. C. Bite cells and Heinz bodies, oxidative damage. D. Basophilic stippling and teardrop cells, lead poisoning. E. Spherocytes and polychromasia, autoimmune hemolysis. Correct answer, C. Bite cells and Heinz bodies. Explanation: Heinz bodies, denatured hemoglobin precipitates caused by oxidative stress. Bite cells result of splenic macrophages removing Heinz bodies. These are classic findings in G6PD deficiency, seen in asplenia, seen in asplenia, TTP, SHUS. D. Lead poisoning and myelofibrosis. E. Seen in autoimmune hemolytic anemia. Would you like a